I am with Dr. Stephen Sorr here today, and I'm very excited about this episode because you are a ball of happiness and light in this space.
Well, thank you for saying that.
You're an energetic spirit who is everywhere. You're training all over the country, soon to be the world. We're manifesting that.
It's happening.
We're
I'm already
manifesting that.
international, but I'd like to go further.
Okay. So you want to go all over.
Yeah, why not?
And this is your fire horse year, you said. You're going to do it.
We're rolling with it.
We're rolling it.
Yeah.
Tell me why, actually, you have the biggest biceps in all of aesthetics.
You know, I didn't realize that this was going to be the thing this year is my biceps. I'm just very consistent at the gym.
Did you purchase scrubs that have shorter sleeves so you could show them off?
No, I purchased scrubs that don't hold on to the golden retriever hair that would completely encapsulate me.
Are the biceps just so big that they just pop out? Are those normal sleeves?
I think they're very normal sleeves. They do come midway. It seems appropriate. They're just doing their thing.
Are your arms shaved?
Lasered.
You laser haired your arms.
Absolutely.
Was it painless?
Pretty much.
Who did it? Lindsay?
Yeah.
Lindsay is your sister.
My sister, yeah.
Younger sister?
Yes.
What's it like working with your sister?
A mixture of things.
Does she actually get mad when you scare her?
No, not at all. She doesn't really scare.
Are those videos real? Does she know that you're going to scare her beforehand?
She knows what I'm thinking. We finish each other's sentences like all the time.
That reminds me of the song from Frozen.
Let it go.
It's amazing.
Oh.
We finish each other's sandwiches. That's what I was going to say.
Oh, yeah.
My daughter is 3 and loves Frozen.
So you've seen this more than once.
I've seen it twice this past 7 days.
That's impressive.
She has worn the same Elsa dress for 8 days straight. I've washed it, though.
Okay, that's what was my next question.
Twice. I've tried to wash it more, but she fights me and won't let me change it.
It's her uniform.
It's her uniform. It is her
Yes.
scrubs with very short sleeves.
I was into Superman back then.
I could see that.
And He-Man. Cult classic.
What do you think about the new He-Man?
I wish I had time to know what that is. Has it come out? Is it coming out?
I don't know. I think it already did.
I'm very far behind on.
I've seen mixed
on that.
reviews. On your next international flight,
Yes,
I think you should watch the new He-Man.
I will do that.
Let's talk about aesthetics.
Let's talk about aesthetics.
What is your favorite thing to perform on someone?
I really love cannula work.
And for those who don't know, a cannula is...
A cannula is a hollow tube that is not sharp on the end. It's very blunt.
2-inch long?
2 3/4, 1.5, depends on the location that I'm applying it.
And it's not blunt, so it means you can kind of dig around in there. And
It is blunt, which means...
it is blunt.
Yeah,
it's not sharp.
it's round on the top like a Q-tip. The hole where the gel comes out is on the side. So you're not cutting tissue.
Do you like that because you can get into areas that you can't with a straight needle that has a sharp edge?
It's safer, it's less traumatic, and with one insertion point, I can hit a variety of areas 360 if I want. It's efficient for me.
So you can spin the needle and the cannula. Is that what you mean by
I
360?
can redirect it.
Okay.
So I pull out, I move in different directions.
Got it. So cannula, where can I have the cannula placed inside of my face?
Top
Or
to
body?
bottom.
Everywhere.
Yep. Temple, forehead, cheek, high cheekbone, chin, jawline.
Are you always using an ultrasound with the cannula?
Not always during an injection, but to map the safe anatomy, the planes that I'm going to be going in.
Okay.
Yes.
I've seen what ultrasounds look like.
Yeah.
It's a bunch of gobbledygook.
Really?
Yeah. To me, it's just black and white fuzz. How can you actually tell what's in there by looking at an ultrasound?
Yes, I can.
You're not making it up?
I am not making it up.
Are you sure?
Very, very sure.
Okay. How do you know? How many layers are there in the skin? So you just count them.
Well, I like to say it this way. The face is like a sandwich. The meat's in the middle. The bun is the skin and the bone. And then you got mayo and mustard. Pick your condiment. That's the fat pads. Superficial and deep. Very simple 5-layer anatomy.
I really like that.
Got to make it understandable.
So there's 5 layers, and you're in with the meats.
No, I do not inject the meat. The meat, if you inject like HA into the meat, not so good. Typically tends to be like irritating to the tissue.
So where are you injecting the HA?
Into the deep fat, preferentially.
And that is
the deeper you go, the sweeter it gets.
Do you ever inject without using an ultrasound?
Yes.
Because of the area?
Correct.
When do you have to use an ultrasound?
So you don't have to use an ultrasound to inject.
Okay.
If you are dissolving
you have
filler, you have to.
Because that's the only way you can see it.
It's the only way to guarantee that you're getting inside of that little bowl of filler.
And if you use an ultrasound and you're dissolving filler, does it dissolve instantaneously?
No.
How do you know that you injected what's it called? The dissolver?
Hyaluronidase, or Hylenex is the brand name.
So how do you know that the Hylenex actually did what it needed to do on that filler?
I can literally watch it going into the ball. There's a saying, close only counts in horseshoes and hand grenades. So if I'm injecting blindly and I think I'm like, oh, I feel it, and I'm injecting and I'm nowhere near it, it's just going to disperse throughout the tissue. It's not going to get inside of that ball of interconnected HA strands.
Wow. What's the most amount of filler you've ever dissolved on a patient?
So I don't know the amount of filler because I don't know what was in there. And most of the time, patients don't remember, and it's an accumulation over time. But I did have a lady who came in, and I had her stand for pictures, and I wanted her to smile, and she didn't want to smile. I'm like, well, why not? She's like, because I can't see through my eyes. She was so filled with a pillow face that her eyes completely shut.
Wow.
And underneath ultrasound, which I can show you, it was just giant globs of filler that were placed over and over and over again through over the years, and she never like metabolized them away. They just sat there.
Do you have an estimate on how many syringes that were in there?
There was at least 3 on each side.
That's so sad that she couldn't do that, but also amazing that you were able to get rid of it.
In 3 weeks, her before and after is shocking.
Wow.
Beautiful.
So do you get rid of all of the filler?
So we only get rid of filler that is causing some sort of harm, either psychologically or whether it's to the tissue itself. Okay. Like if you look like you don't know what you look like anymore, that's a form of psychological harm.
Yeah.
It's a distortion.
Yeah.
And sometimes it's okay to let it go.
Is that another Frozen reference?
I think that's going to be our theme. I thought it was going to be the fire horse, but it must be Frozen. It's on your mind, so I'm just picking up what you're putting down.
No, it's okay. It's a little cold in here, but the cold really never bothered me anyway. Okay, so you don't have to use an ultrasound, but it's helpful with the dissolving. Are there any treatments that you don't do because you think that they're scary, unnecessary, scary meaning like it's really risky, or things that you don't want to offer?
So I am one of less than 5% of injectors in the world that have an ultrasound. So 95+% of people do not use visual guidance.
They don't even have it.
Not even in the office at all. I know some people that have it and just sits there. They don't use it at all. I find it so quick and easy once you're competent in using it. It just sits there and I just put it on the face. I'm like, okay, there's no blood vessel where I'm going. I'm good.
Yeah. Do you still aspirate?
No. Some areas I might, but usually no if I've already scanned it. No. With the cannula, the risk of hitting a positive flash, if you will, is very low. With a needle, in complications, there's about 1 in 6,000 per se. With a cannula, it's 1 in 40 to 50,000. So the chances go down. And the larger the gauge of that, or the diameter of that cannula, the safer again it is. There's certain areas that you want to use a cannula, like the temple.
Yeah.
A lot of blood vessels. You can see the bulging veins. We don't want to hit those with needles.
I've seen your before and after.
Yeah. My before and after.
I don't think you were ugly.
I didn't think I was ugly.
No.
I looked a little bit tired and maybe hungry.
I think you looked nice.
Thank you.
But what work have you had done? Would you like to talk about it?
Sure. I'm an open book.
Okay.
It all started back over a decade ago. Cue the music. Saved by the Bell, when they do the little cutaway.
Oh, yeah.
Good stuff.
I remember.
I was a Zach Morris fan.
I was a Kelly Kapowski fan.
I can see that.
I could see that.
See, I didn't know. I didn't know that, but now I know. Yeah. So I've done microneedling. I've done lasers. I've done radio frequency microneedling. I think tox is a given just to slow the expression of the facial muscles, like your glabella, your frontalis.
Yep.
I've done a little bit of filler in the mid-face.
Mm-hmm.
I think that's been a big game changer for me.
Are we talking a syringe?
I mean, I've done many over time, but it goes away.
It goes away. You metabolize it.
Like a hummingbird. I'm hungry.
I think I just figured it out.
Yeah.
The filler has migrated to your biceps.
It does migrate, doesn't it? All the way down to the biceps.
And it looks like the triceps too.
You know, the triceps are more of the size of the arm than the biceps. You've got 3 of those and 2 of these.
Buy and try. Makes sense.
The math adds up.
So are you the first case study of someone that has had filler migrate from their cheeks to their biceps?
I must be. We should probably write up a case report and use ultrasound to confirm that.
And when you say we,
I always say we.
you're not talking about me.
Probably not. I don't think you're the person to be able to determine that on the screen. I could take a look at it.
I use Claude and ChatGPT.
Hey.
I could help you.
So I put Chad in the friend zone, and now Claude and I are going steady.
Same.
Yeah. It's unbelievable.
It has gone downhill.
You thought you were having a good relationship, and then you found something better, and you're like, what was I didn't know what I didn't know. Missing out.
It's crazy too, because I literally stopped using it.
Chat.
Yeah. And now it's all Claude.
I still use chat.
I mean, I have to a little bit.
Yeah.
But not much.
Well,
it's pretty much chat.
I'm running into a use issue. I have to wait till 3 p.m. today until I can start using Claude again.
Are you not paying?
I am paying. I'm just having it do things.
A lot.
Yeah. I'll be showing you what I'm creating on there. It's incredible.
Is it related to aesthetics?
Yes.
Oh.
But mostly on the functional medicine side.
Let's talk about functional medicine.
Yeah. What would you like to know?
Everything. Let's start with 10 years ago.
10 years ago. Cue the music.
What is functional medicine?
Functional medicine is simply great healthcare. Meaning we have time to listen to our patients. We're compassionate and patient-centered. We spend time with patients. We get to know them. We ask them the questions. This is something that everybody should do with their doctor, but it's pretty much impossible to do in 10 minutes.
It is impossible.
Impossible.
In 10 minutes.
Yeah. When we take a history, we're looking for general tenets of health. And if there are opportunity gaps, we want to first fill those in. People come in to me because they hear functional medicine, they hear about all the things that I do, and the first question they ask me is, do you do peptides? Okay.
Which is an understandable question.
Totally, sure.
Because a normal civilian hears all of this stuff and sees this content on social media about peptides. I've been on this stack for like 8 weeks and I'm feeling this much better, and look at this before and after. And it's crazy. You also can't take anyone's word for it when they just tell you what they've been on, because you really actually don't know.
If they're stacking that, what else are they stacking? Humans are really hard to control.
Yeah. Has their diet changed? Has their exercise changed? Has their sleep changed? Has their stress level changed?
Yes. Those are the tenets, the very base foundation pillars that we have to work on first and foremost.
Okay.
So are they also getting a placebo effect? I had a guy come in. He said, I started peptides and I have a lot of energy. I said, oh, okay. I'm like, let's go get some blood work done. He's like, oh, I'm really nervous with needles. I'm like, pause. You're nervous with needles. Not excited, nervous. So when he gets his blood drawn, his heart rate elevates.
Yeah.
So now he's self-injecting. That's going to spike your adrenaline too, sir.
Did you tell him that?
I did.
And?
He said, good point.
Point,
Unintended.
point like a needle.
Point like a needle.
Yeah. You didn't need to say pun intended because I got it.
You were picking up what I was putting down.
I did.
Cool.
We can let that one go, though.
I'll let it slide.
No, we can let it go.
Oh, Elsa. Yes.
It's okay. So once...
You really like this show. You're kind of forced to love Elsa.
I listen to nothing but princess music because I am the father of a princess.
Yeah.
And when you have a princess and you are the king, you no longer get to choose your music. In fact, when I'm driving alone now, I don't even like listening to music. I just turn it off.
Silence.
I'm able to hear myself think. Have you ever heard yourself think?
It's all the time.
Yeah.
Mm-hmm.
If they put an ultrasound to my head, they would see princess music, brain waves dancing around in there.
We need to get you out of the house.
I'm out of the house today.
They let you out.
Somehow. Let's talk more about the sandwich.
Let's go to the sandwich.
Do you use the sandwich when you're using peptides or any of the functional medicine?
The sandwich of the face. Or do I use...
Is there a sandwich of the body?
I mean, we're all a sandwich of... We're all like layers. I'll quote a different movie.
Onions?
Like onions. We have layers.
Okay.
Shrek.
I didn't remember that. Oh, I think I do remember that one.
It's in there.
I remember it now. There's so much princess memory.
There's a princess in that. You can start that up. Diversity.
So somebody comes in, functional medicine for you is about taking the time necessary to actually help them understand why they're there. Because sometimes people probably don't even really know. They know they want to feel better.
Of course, people don't feel their best.
Yeah.
That's why they go to
and that's
a
why
doctor.
they're there.
Right.
Yeah. But they don't know like what's going on.
Correct. And it's our job to put on the Sherlock Holmes hat, do the investigation, and then report the findings.
Okay. Through blood work?
Blood work and history taking.
History taking. Lifestyle reporting to you? Like
That's part of it.
Mm-hmm.
Yeah.
So what's a protocol like? Somebody's coming in and seeing you. Mm-hmm. Do you wait for the blood work to come in, bring them back in for a follow-up appointment, and then say, these are the things I recommend in order to get where you're wanting to be, or these levels are low? What's going on?
So when we take a look at the report of findings, when we look at the blood work and we look at their history together, I can do this extremely fast at this point, but we can go over the blood work together. I draw pictures, diagrams, tell a few jokes here and there. And by the end of that, they understand that there's a lot more to their health and there's this interconnection between their labs. So if they go to their other doctor, previous doctor, they said, oh, they did a full panel 2 weeks ago. I'm like, let me see your full panel.
Yeah.
It's not full.
How full? How many pages are we talking once they come to you? Like, what's the result?
It'll be 2 or 3 pages.
Yep.
Mine's 8 or 9. Now, you might think that that is overkill, and for regular medicine, they're not asking the questions because they would rather send you to a specialist for this and a specialist for that.
Mm-hmm.
But it's understanding how all of these different markers are playing together.
Mm-hmm.
It's a snapshot. I can't tell continuously how you're doing. So, for example, if you're nervous about needles and you're getting your blood work done, and you've been thinking about it, oh no, is your cortisol level going to be up? It is. No coffee needed. Your cortisol will be high. But if they're not, we have to take that into account. If they're not, and they have really elevated cortisol, what are we looking at with their overall energy matrix? How does their brain decide how to partition energy? Where to give you fuel? Where's the gas pedal and where's the brake? You have to make sure that people understand how their nervous system is performing before asking anything of them. A guy comes in, and I'll ask you the same question, point blank.
Yeah.
Do you get morning wood?
Mm-hmm.
Good.
You're asking me.
I just asked you.
It depends on the day.
Okay.
Mostly no. Should I be?
It's a good indicator of health.
Interesting.
It's an early predictor of cardiovascular health.
Interesting.
Yeah. It's all plumbing, right?
Yeah.
and hormones and signals. But you have a young child who probably doesn't let you sleep the best.
She wakes up around 6. So I get about 6 to 7 hours of sleep.
So that's fine.
Yeah, I would say she lets me sleep.
That's good. You're lucky.
There was a lot of sleep training.
That's important. So you did some parenting ahead of time.
I did. Just not very much. I don't know what I'm doing.
So I have a question for you. You have to take a test to drive a car, right? It's called the driver's license test.
Yes, I did do that.
What if we designed a test that says, hey, listen, we want you to pass this. Take this.
I see where you're going.
Before it actually, you've got 9 months to prepare, right?
That's a tough one.
I know. We want you to win. You can take it over again.
There's classes.
There's resources.
There's YouTube videos.
You can even talk to your friend Chad.
Chad GPT.
That's right.
I don't talk to him anymore.
But he's a good friend.
He was.
Till
he sucked.
I just put him in the friend zone.
My friend Claude.
Yes.
Way better.
Oh, no.
Way cooler.
He's not a friend. We're dating. It's getting heavy.
Oh.
I can literally speak to Claude like my brain is a computer and it knows exactly what to do based off everything that I fed it to it.
Do you use Claude to help analyze results of blood panels for your patients?
I don't know.
What if you did, though? Wouldn't it be helpful? Because you're not saying, tell me what you see here. You're saying, come up with this analysis and help me see all these things. This is what I want.
Mm-hmm. So it can go off of general references and guidelines that are already published, if you will. Mm-hmm. But the reference ranges on blood work are very, very broad in certain areas.
Okay. So it wouldn't have the knowledge to tell you what you want to know.
Right.
Could it someday?
I have fed it my personal. So
you use its memory.
I've given it memory.
You've created its memory.
Yes.
To help understand for you personally?
No, for my trainees, for all my students that I teach.
Do they have access to that?
They're getting access to it.
You're coming up with your own GPT.
Uh-huh.
When is it going to be out?
As soon as I can get it to pump out more content. I just have to wait till 3 p.m. every day.
What were you just looking at?
It's my fake watch.
I thought you were looking at your biceps again.
No, I was looking down at my wrist. My forearms
are
also good size too. Half past the freckle.
So your GPT is almost ready.
Almost ready.
Who can use it and what's going to be in that GPT?
This first iteration will be partitioned just for prescribers only. Okay. Then I'll have a platform where patients, the public, can go ahead and upload their things, and it gives you a partition of it, and that can then interconnect with your healthcare provider.
Will it be reviewed by a human before the answers?
Yes.
You?
Whoever the provider is.
Oh, okay.
Yeah. I don't need to covet the information.
Yeah.
I'm just one person, and there are 8 billion people. That's a little bit. I like working. I'm a hard worker. That's too much.
I would agree with you.
So that's why I love to go around the country and teach at different conferences and help people, because I learned it so you can learn it.
Yeah.
I might not have learned it. You might not have learned it in the easiest of manners in school, but we can say it simply. People get it. Move on.
Yeah. How long do you think it will be before a humanoid AI bot starts injecting?
Ooh, I don't know if that's a good idea. For larger areas,
let's say this. It's probably not a good idea for a really long time.
It's not a good idea
but it's going to happen though. We know it's going to happen.
I will not be the guinea pig for that one.
I won't either.
But we do have a robot that can help with extracting follicles for hair transplants.
That's cool.
Mm-hmm. That's been around for a while. It's called Artis.
When do you think they'll make one for injecting neurotoxin?
There has to be some sort of understanding of the depth of injection with neurotoxin.
Couldn't they install an ultrasound?
You have to have gel on the face, and that needle must be directly underneath that probe to visualize it appropriately.
So it's pretty tough.
That would be very difficult to do.
And honestly, from what I've seen with ChatGPT over the past few months,
Yeah.
it's going backwards.
It's devolving a little. There's too much information.
The information sucks now. That's the problem because of copyright and things that they didn't own. I think that's the issue. What do you wish was different about the aesthetics industry? Like the thing you wish was the most different?
That we stop thinking of it as an industry and more of the field of medicine that it is.
Okay, let's make the change now.
That's how I language it always.
So aesthetic medicine, on a previous episode, I was talking with someone, with Morgan, you know Morgan, about this space, this world. And I said, why isn't there standardized rules that everyone has to follow in order to be able to inject? And I asked the question, does it happen with other like fields of nursing to where you have to go through certain courses in order to be that nurse? And she said, yes. And so I said, well, why isn't it like that for aesthetics? Because it's medicine. And she's like, exactly. People are now finally coming around and realizing this is medicine too.
Cat's out of the bag.
Why don't you like to call it an industry? Does that make you feel like it's a machine or?
You know, it's personalized medicine.
Yeah.
At the end of the day.
Because we don't say like ER, the ER industry.
No. There's the hospitalist, and everything in the hospital is a whole system. I have no place in there.
Yeah.
That's not my world. But that's critical care. That's, you know, saving people's lives. You don't go there because I am feeling a little tired today. You don't go to the hospital for that.
Yeah.
It's really meant for urgent and emergent findings. With family practice, where we used to go, if you go back 50, maybe 75 years, your family doctor that was in your town kind of knew everything about you, was able to handle most of the things. We need to have a little bit of a renaissance with that and utilize our tools, utilize our advanced technology that we can put them together. It's all about integration for me.
Okay. I like that. One thing I admire about you is that you really are like at the leading edge of a lot of things that you do. You know how important it is, just ultrasound, for example, you know how important it is to have that tool. It's not everything and you don't need it for every single thing that you do, but also you're leading in a lot of things and you're teaching other people how to do this as well. It's very important what you're doing. I admire that about you. I also think it's great that you offer such personalized care. I didn't know that.
Yeah.
I didn't know that it was such a detailed thing. And it makes sense with what you just said about, 50 to 75 years ago, the doctor in the town knew everything about you. So that's also very helpful when you think about it, because they'll know your history. And if something feels different now, they may have an idea of what's happening. And you can't learn all of that in 10 minutes. Right. I just had my blood pressure taken 2 or 3 weeks ago, and it was 140/80.
A little spicy.
Never happened to me before. Okay. New place.
New doctor's
I've never
office
been there never been there before. It was my first time.
Were you nervous?
Probably.
Do you get nervous when you go to a doctor?
I do.
So we call that white coat syndrome.
Yeah. So here's what's funny. That number registered in my head of being higher than I had ever heard. Mm-hmm. So I Googled it really quick. And she's like, and Google says, you have stage 2 hypertension. And I was like, no, I don't. So the MA left. The NP came in. Mm-hmm. I said, hey, can you take my blood pressure again? 10 minutes later, 130/80.
Yeah.
I went home and I bought an at-home blood pressure monitor.
That's what I recommend.
The following day, the first time I took it, still 130/80.
Okay.
Then the next 2 readings, 120/80.
So what does the top number tell you?
The systolic
That
pressure?
is called the systolic, the top number, yeah.
And that's how hard it's pumping into my body, right? So it means that it's working harder to get blood through my body, right?
More pressure.
More pressure. But what I realized is, as he was telling me we should talk about medication, knowing him for 5 minutes, talking about calcification or coronary calcification, a red flag, a beige flag, red flag said, don't listen to everything he's saying. Start with the at-home monitor and then go from there.
Right.
And now I'm like, okay, it probably was white coat syndrome. He probably just psyched me out. My toddler was there with me. I was watching and taking care of her. Like, it's not easy to be in a doctor's office. It's boring.
So that's not your baseline.
No, it's not.
So that 10-point decrease between the MA and then the doctor, and then another 10-point drop when you're at home doing nothing.
Right.
That's your nervous system.
Right. So that was interesting.
Right.
And I feel like talking to you, I'm understanding this.
If you just
better.
understood, it wouldn't be this amorphous enigma. Like, it's not confusing. If you can just see the forest from the trees.
Yep.
Just make it simple and clear.
Yeah. So when people come to you and they say that they have a problem and you do all this blood work and you talk them through it, because you're very calm. Yeah. Like when we're in like a consultation scenario, I can feel that that's there. Mm-hmm. How long does it take generally for the average person to like get back to baseline or where they want to be, or like even if that's a higher elevated baseline?
Sure. Well, it's all about that person and what they're coming in with. I've seen thousands of patients, so it's a bell curve. Some people are really good. They're already dialed in. They're just missing a couple little things, and some don't have any idea what food is, how it works. So I work with them on that. They don't understand.
You talk to them about food.
So my background in clinical nutrition is pretty intense.
Wow.
And prior to being a doctor, I went to Le Cordon Bleu. I was a chef. So I know a couple of things about food.
Wow. That's very helpful
Nutrition.
for a lot of people, because there's really not a lot of education around it.
Especially on medical weight loss.
Yeah.
So people are like, do you do peptides? They come in asking me, do I do peptides? And they're wondering if I do the GLP peptides. Like peptide just is a blanket term, but what do you mean? You mean weight loss? Or
they want the weight loss,
right,
the appetite suppressors.
It's not the only peptide out there. Like there's an app for that. There's a peptide for that. But at the end of the day, if the person doesn't have the information and they're not working on the big macro scale factors, a tiny little peptide doesn't do that for them. It's not going to give them the information that they're missing.
Yeah.
So I always like to galvanize my patients with knowledge. They have to be empowered and also motivated to make changes. It's behavior change when it comes to functional medicine. Let's use myself as an example, because like I said, I'm an open book.
Yeah.
I graduated med school, opened up my business. It was a little, what we would call stressful. I didn't have any forecasting of business. I have created every good and bad outcome that has happened. My testosterone at that time was less than 400, 383 to be exact. I had a hard time in my first year taking the foot off of the gas. Mm-hmm. I didn't even know where the brake was. I was like, I can't leave my baby. It was like a newborn. I had no idea what to do. And a lot of people, I think everyone who opens up a business kind of has that to some extent.
Oh, yeah.
So I had no idea. I didn't feel bad, but my testosterone was super low. I think I slept fine. I thought that I ate fine. I thought that I was exercising okay. Probably could have done a little bit more. Mm-hmm. So once I put my foot on the brake, I found it. It doubled. And since then...
Without taking TRT?
I have never once taken testosterone exogenously.
And now it's in the 800s, naturally.
Over 900 last reading.
Yeah. Find the brakes.
Do you think
that that's typical for any person? Like, is it just the stress, or is it the sleep, the nutrition, the stress,
It's really the whole picture, but stress is a physiological signal that says, don't think about reproducing, don't think about relaxing. You need to run away from whatever lion, tiger, or bear is chasing you.
Yeah.
In reality or in your mind, it doesn't matter. So when we focus on that foundation and they're able to then encapsulate that, put that on a shelf, they're like, I don't have to pick up that stress ball. I can leave that alone. So now my vision is clear. If I take care of myself, what did they say on the plane?
Put your mask on first and then help the people around you. Yep.
Right.
Interesting. Doubled. That's crazy to me.
I didn't understand it. I couldn't believe it in myself.
Wow.
Now, I've had some examples where I had a guy in his 30s. His testosterone was 181.
Mm-hmm.
So
that's low.
That's unbelievably low.
Yeah.
And he's working out, doing all the things. So through my diagnostics, his pituitary gland just does not produce the signal. And we even tried to amplify that signal, and it still did not result in anything significant. So we put him on testosterone. But that was a pituitary issue, not a testicular deficit, if you will.
Is there a way to fix the issue with the pituitary gland that you could have done, or no?
So we have to go into a couple of things when we're working that up. There could be some abnormality anatomically with the pituitary gland. There could be a cyst or a mass on the pituitary gland that's suppressing it. So sometimes if we ask a question like, do you get headaches out of nowhere? Are they getting worse? Is there double vision? There are some rare circumstances where that happens.
Yeah.
And we work that up.
Okay.
There's different things in our algorithm for what's the cause of the low response or the hypogonadism.
Yeah. So maybe how often are you then prescribing TRT?
Pretty regularly.
Yeah.
Yeah. So that's a 30-something-year-old. If I have a guy who's over 40, over 50, and they're at the gym and they're like, listen, I'm doing the same thing I've done. I'm not seeing the results that I used to.
Yeah.
What is going on? How's your stress? Guy came in 1 out of 10. I'm like, you have no stress. He's like, no. But I'm just not seeing the gains at the gym. Like, can't wait to see what your blood work looks like.
Yeah.
Sometimes it's testosterone. Sometimes it's not.
It's a huge puzzle that you have to figure out.
Correct.
So that's why it's 8 or 9 pages.
We don't rush to treatment. My goal is to get the best working diagnosis that I can. If I could diagnose life out of balance, it's not in the book. People have life out of balance. They're stressed. Our level of stress in our world is so unkind to our physiology because we did not evolve with stress like that persistently. It's changed in the past 100, 200 years.
Oh, yeah.
A lot.
How much of your practice, whether that's you alone or your practice in general, Source of Health, is focused on this type of care as opposed to aesthetics?
I put them together in the same page, really. Integrating them together makes a lot of sense. If I'm going to be doing a laser, any biostimulator, whether it's Sculptra, Radias, PRF, PRP, all of those, I would love to see what's happening on the inside. And I learned this the hard way. I had a patient come in who happened to be an expert in nutrition.
Are we air quoting?
We're super air quoting. Skinny as a stick, PhD in nutrition, and
a literal PhD.
I'm not kidding. And had no response with Sculptra, nothing. So I said, could we take a look at your blood work?
How did you know there was no response?
There was no response.
So before and afters, how many months apart?
6 months.
And literally no change?
No change.
Wow. Have you ever seen anyone else like that?
People that absolutely do not eat.
So that's what it is?
Yeah. It's an eating disorder.
So then you did a blood lab or panel.
Yes.
And what did you find?
She was in her 40s. She's not had a period in years. And her protein in her metabolic panel was low. Her cholesterol and triglycerides were unbelievably low. No medication involved. She was just hungry. So you can stimulate all you want, but there's no substrate for repair.
That's a delicate conversation to have next.
Yeah. And she heard every word I said and decided to just not continue with me because her version of reality was the one that was going to win at the end of the day, and nothing I said was going to change that because it's an eating disorder.
That's tough.
We have people that have certain stigmas and beliefs about food.
Yeah.
And food should not be the thing that we're obsessing and focusing over. I like to eat to live. I've changed my paradigm. I used to love to eat, and I just don't really care that much anymore. I'm doing too many other things in the world to think about chopping up an onion and adding all. It doesn't matter to me at this point in my life where I'm at. Former chef.
So you don't cook for yourself anymore at all?
I do heat and eat and prepare very simple things. I don't like to spend a lot of time focusing on that.
If I were to cook for you, would you judge my cooking?
No, I don't do that.
If I wanted you to, would you?
Of course.
Would you be honest and tell me how good it was?
Or how bad it is, yeah.
What do you mean?
Depends if it was good or not.
Why would it be bad?
I don't know your cooking level, your skills.
We can assume they're great.
Then I'm sure I would enjoy them.
Yeah, I think so too.
Yeah.
What would you like me to make you?
Love fish. Salmon's a big one.
Do you eat Atlantic salmon?
I don't have much of a preference anymore.
So it doesn't bother you, the farm raised, color added?
So the farm raised color added thing. Back in early 2000s, there was a study that came out showing people that farm raised salmon was not that good because And then in 2014, they revised it and the farmers fixed those deficiencies, and now it's better for you than some of the wild ones. I know that's a hard one.
Really?
Yes.
So you're saying that sockeye...
And the color added. First of all, sockeye is a very strong flavor.
Yeah, it is.
That's not going to be palatable for the majority of people. It's too fishy.
It is very...
It's a little much. Okay, I'll give it that. But the color added is the same color that the wild salmon get too. It's just astaxanthin.
Astaxanthin is red 40?
It is not red 40. It is certainly not red 40. How do you know?
How do you know it's not red 40?
Red 40 is a chemical, and astaxanthin is a beautiful carotenoid.
That's correct.
Thank you.
That's right. So my daughter loves eating Atlantic salmon.
Okay.
I haven't told her that it's farm raised yet.
Okay.
I probably won't.
It's a large farm. It's not like it's in a pool. It's like just netted off.
Okay.
Yeah.
How large are we talking?
I am not a fisherman.
I thought you were a chef.
I was a chef.
You never toured a farm?
No.
Okay. Interesting.
I have been up to Alaska and caught some salmon though.
I want to go there.
Beautiful.
I think
great summer trip.
Summer. Yeah. I want to do a cruise in the summer.
It's great.
What kind of salmon was it?
Coho?
Yeah. Coho's a good one.
Very good.
Not as fishy as sockeye.
There's a king salmon, but you got to go at a certain time of the year. You got to time it out just right.
Speaking of salmon, they have sperm.
They do. Oh, we want to talk about salmon sperm.
Do you want to talk about it?
I love it.
How do you love it?
On my face.
Okay. What does it do?
So it's no longer...
Why are you laughing?
It's no longer sperm at that, because I was thinking about salmon sperm on my face.
What do you
mean? Visual learner.
Okay.
So when you take the salmon sperm and you process it, you're essentially getting pieces of DNA. They're heated. It's no longer sperm anymore. It's just polynucleotides. Nucleic acid are the building blocks of DNA.
Sure. Yeah, sure.
Amino acids are the building blocks of protein.
It's sperm.
It was once. It's just very easy to come across.
It's easy to market it as salmon sperm.
I like easy to come across. I feel like it's
I got it. I got
better
it.
tagline.
An interesting choice of words.
I'm an interesting kind of guy. So it stimulates the fibroblast to produce more collagen, and it also helps on a salvage pathway to help our cells renew themselves. So it has a rejuvenating effect on the tissue.
Is it better than exosomes?
I don't like to use the word better. It's a component in our regenerative tool belt.
You don't like to use the word better at all?
I use the word better a lot.
But you don't like it?
You're trying to compare exosomes, which are amorphous in whether they're good or not, or what their quality is. They're sourcing the lot, whether they're stable or not stable in the vial or the tube or wherever you're getting it from. So there's a lot more variability.
So it's better. I'm just
I
joking.
still wouldn't say better. I would just say it's
If you had to choose, you just got microneedled.
Yeah.
And you had the choice, the red or the blue pill.
Oh, you know my red and blue pill story.
I do not.
You don't.
Are you Neo Anderson?
Mr. Anderson.
Yes.
So I've used this before.
Okay.
Whether people want to work with me or not. I'll go back to yours. And I say, listen, life is about choice. You can play the victim or you can play the warrior. I like to help the person who wants to be a warrior. Okay. So when you come back to see me, your question should be, how do I do better? That's my better.
I like that.
So in your world, what we were talking about with the blue pill and the red pill, when we're looking at how to revitalize and nourish the skin and get it to go back to where it was, that's really what the goal is here. I'm not talking about alternative or other use cases of these, but exosomes are signaling vesicles. They're little bubbles of information, just like the postal worker gives you a letter and gives you instructions.
Yep.
Salmon sperm or polynucleotides is one note. It's one type of signal.
Okay.
So it's better to have a symphony of things in proportions with one another. So when we're looking at how to get the tissue ready for something like a big laser, I would like to prime the skin, give it nutrition, give it certain signals, growth factors, peptides, all the like to the skin prior to doing something like a big laser. May I let your listeners know about something that I've been working on in the background?
Yes.
So I had a colleague reach out to me about helping to prime our tissue for larger treatments, and I formulated a pre-treatment supplement. It's a drink, calling it a cosmeceutical. So it's a procedural enhancement tool. So we did a clinical trial on this.
Really?
Yeah, we're going to get it published here probably within the month.
Amazing.
So we did a CO2 fractional ablative laser. Basic tenets, 10 people got just the laser. 10 people drank it every day for a week before. And then another 10 drank it 3 weeks before.
Every day for 3 weeks.
Mm-hmm. It's delicious.
I can't wait for you to tell me what happened.
So not only did they recover from the laser treatment better, their skin over past 60 days had more hydration. The pigmentation from UV damage had improved. Their mean average wrinkle texture score had improved as well. It's a dose response curve. Unbelievable.
Is it helpful for recovery or is it helpful in general? Like what if they hadn't been recipients of the CO2 or the laser, whatever? It was CO2, right?
Yeah. This was our first clinical trial, so we wanted to use
You wanted to have that variable in there?
Correct.
Do you think, I don't know if you're going to want to say that.
It's plausible.
It is. That if they didn't even have it, it still would have helped? If they didn't have the CO2, that the recovery
we can
still
do
there?
just drink it and then do it before and after we could, but we wanted to give it a little pop in the right direction.
You're going to do a clinical trial of not having a treatment with it, right?
Sure. That's easy to do. I just wanted to do something.
Dr. Sorr, it's
pretty exciting, actually.
You should have told me about this earlier.
Oh. We were talking about Elsa and other things.
Were we? Yeah, that's right. And salmon.
Talking about salmon.
Where are you going to put your salmon farm on the map?
In the huge open water, big water out there somewhere.
I was thinking of doing mine
water
in the Grand Canyon. There's lots of space for me to fill it with water and have a lot of salmon.
Ooh, it's a little warm though.
It depends on the time of day and the time of
Salmon
year.
like it cold. So you're going to like transport them in.
And take them out. So this drink that you created, what's the plan for that?
So it'll be available in doctor's offices, med spas, surgeon offices to give to their patients at the time of their consultation.
Wow.
And preparation for the procedure. It's incredible.
This is very exciting. Mm-hmm. Is this going to be a new company? Mm-hmm. Are you the CEO?
I'm not the CEO.
What are you?
Medical director.
Who's the CEO?
I'll release
Someone
all
that
of
you're
that.
not able to say yet?
I can say her name is Laura. She's wonderful.
Okay.
But we're working on all the details right now, and the website's just a few little clicks away from being ready to go.
How can people get it? Are you going to have sales reps? Are you going to, is it all just they have to come straight to you and purchase it, or what?
That's a
TBD.
good question. TBD.
Okay.
We're going to have it distributed through certain channels, and click the link in my bio to learn more.
Swipe up.
Swipe up, all the things.
I like this.
Yeah.
Will they get a free ultrasound if they buy enough cases of the product?
They probably won't unless that number is very significant. It's not very expensive.
I'm excited. So
Yeah.
is it going to be sold over the counter too at some point maybe?
Perhaps.
Because it's not a prescription.
No.
Wow. This is really cool.
And it tastes good.
What does it taste like?
It's like a citrus berry. It's very refreshing. It's a good mixer if you want to go there.
I don't.
Don't.
Okay.
Just drink it every day.
I won't. Cold.
Yeah.
Does it have to be cold?
No, but it probably just tastes better cold. It's like berry lemonade. It's delicious.
Do you drink it every day?
Out at my office every day. I just got the first case like 2 weeks ago. Wow. Yeah.
That's exciting.
I know.
Are you going to offer it to Source of Health patients if they come in?
I already have.
And?
They love it. I was just at the Princess this past weekend. Modern Luxury Magazine had an event there, and we had shots of, it's called Foundations.
Okay.
We were taking foundation shots, and everyone loved it. So
that's really cool.
Taste test approved, and then the ingredients, they don't compete with anything like drugs or other supplements that you're on. It's not going to impair your surgical history as well. Like if you have to go in for surgery, there's nothing there that's going to like thin your blood or anything like that. So
this is incredible.
Thanks.
I can't wait to see what happens with this.
Yeah, I can't wait to formulate another product too. I have a lot of ideas.
Really?
Yeah, we'll see. Time will tell.
Sounds like you're setting us up for more podcast episodes, Dr. Sorr.
Might be another podcast. There's so much to it. Got a lot of things going on.
Yeah, you do. My last question is, do you perm your hair?
No, never have, never will. This is just shake it out of the shower.
Does someone else perm it for you?
No.
That's amazing.
Yeah. Just curls.
Have you always had curly hair?
Yes and no.
So the no is you didn't have curly hair before you started perming.
I never wore it this way. I didn't let the curls do their thing. I just like used gel and I slicked it and tried to hold it down and try to control it. And then I just said, let's let it be.
Yeah. That was almost let it go.
I know. I felt it. I just let them go. You don't have curly hair.
It gets a little bit wavy when I let it grow. But when it grows too long, it looks like 90s dad hair. Think Mr. Belding, but with hair.
That's great.
No.
It's not good.
No. My wife won't let me get it past about right here.
Okay.
Because then it's just too long.
It's too much.
And then I said, can I get a buzz? Like, would you be okay with that? This is first year of marriage. Mm-hmm. She said, yeah, you can do whatever you want. You just won't look cute.
Two most important words in your marriage are, yes, dear.
Yes, dear. I said, all right. I haven't gotten a buzz in over 16 years.
You've been married 16 years.
A little over 16.
Congrats.
Want to know the secret?
Yes, dear.
You already know the secret.
I already knew it.
Do you tell yes, dear to Claude?
No.
That relationship's not going to last very long.
Probably won't.
Yeah. Back to Chad GPT.
There might be something better out there. Who knows? Got to keep my eyes open.
I don't know, maybe. If you could tell somebody, your patients, that have been on the fence about either booking with you or they've been nervous about trying certain things because they don't know if it's going to work for them.
Yeah.
I personally think that your approach of researching and figuring out and like learning everything beforehand is really good. But what would you say to them if they're just hesitant?
I love a healthy degree of skepticism. I love it when people come loaded up with questions that they don't know how to quite ask, but I know where they're coming from and I can help deliver them that clarity.
Yeah.
It doesn't take a lot of heavy lifting, which I think is great. If you look at a woman who's over 50 years old and she no longer produces hormones because the ovaries no longer have eggs, it's over. The best treatment for that is just to replace what is no longer there. Is that fair?
Yes, it
What
is.
happened if men no longer produce testosterone when they hit 50?
A lot of things would happen.
Our entire paradigm would shift.
Yeah.
But it doesn't. So
And it
that's
happens,
not fair.
and it happens to all women.
Everyone that I've ever seen in the history of history, it happens. There's only so many finite amount of eggs, and once that's over, then that's menopause.
And everything changes.
Unless you precede that, which is safe to do and effective to do.
Yeah.
So we have to meet people where they're at and help lead them where they need to be. We know what the evidence is. We know how health goes. We know what people expire from. So I always like to begin with the end in mind. I do advanced cardiometabolic health history. We look at trajectory. We make sure these changes are going in the right direction. To the best of our ability, we can't control if there's an accident, but if it is within your power and you are living your life on purpose and you're doing these fundamental things that are so effective, you don't need a peptide for this and peptide for that. So I think it's important to always empower people with their own knowledge of themselves and grant them the space to figure it out on their own instead of just saying, I need to hold your hand forever. That's capitalism.
Yeah.
I don't need that. You just need a doctor that you can trust, field your questions with, and then maintenance at that point is great. I love to see people twice a year for that. And then I can see you for aesthetics, whatever you want.
Yeah.
Anything else, is optional at that point.
Yeah. Thank you for that. I feel like there is just this big hurdle that people have to go over. My heel's been hurting for 2 months. I don't know why. I've changed some things to see if that isolates the problem and gets rid of it. It's not. So I'm going to have to go do something else. And I think that we get to a point, everybody, where, we're dealing with problems for so long. We need someone like you who I feel comfortable around talking about this stuff, and that you're not going to judge me. You're not going to make me feel small. You're only going to just listen and say, because you're very factual and logical. You're like, okay, cool. Yeah. If you're feeling this way, this is what we can do.
Yeah, we can figure it out.
Yeah.
Together.
I like that.
But you need objectivity.
Yeah.
I have a large base of information filed away, and when that time comes, it's there, and we're not starting from literally like square one. We know where to go from there.
Yeah. Before we end this, which thank you, this has been one of my longer episodes, but I feel like it was good.
Goes by fast.
Yeah. What is, could you share a dad joke?
Yeah, this one came across. I like, when I give my dad jokes, I love them to be more just statements, but I'll ask you a question. What famous actor does Arnold Schwarzenegger compare a colonoscopy to?
Please tell me.
Cameron Diaz.
Thank you for listening to this episode. There's no one listening still. No one's listening. If you've made it this far, your phone has not shut off and you have walked away. But thank you for leaving it on and increasing my listening time.
It's been a pleasure.
Please take care of yourself, especially after that one.